fact, benefits of teaching yoga, it actually is very helpful as a politician because I've gotten good at doing random things and being able to just keep up a random stream of conversation while doing it. So you never know when your life skills are going to come in handy.
Well, that's good because I was quite apprehensive to interrupt you while you were doing it, but I really liked the light and the composition and the opportunity to catch you in a relaxed, sort of rejuvenating situation.
No, my shoulder's been really bothering me. I've been to every single corner of the province and my neck is hurting, everything's hurting. I had amazing actual Green friends, members of the Green Party, who one's a massage therapist and one is a acupuncturist, both of which, by the way, in my health plan for the Green Party, I would have services like that covered. I feel that our universal Medicare plan, as Tommy Douglas first introduced it, was meant to be more inclusive, right? Like I can remember a time in my life as a child in school where all of our dental programming was actually paid for. Dentists actually came right into the schools and looked after my teeth as a kid. I believe that Saskatchewan should have that reintroduced back. Every school child in this province deserves to have their teeth looked after. One of the key issues with poverty and finding meaningful work, if you don't have a nice smile, it's really hard to land a good job. This is something that the Saskatchewan Green Party would make immediate moves to fix. I would also like to see elder care included in our Saskatchewan health plan. I want to see a system where we're actually making sure that mental health is covered underneath our universal Medicare plan. Mental health is a pandemic in this province, just like COVID-19. We have the highest suicide rate in the country. We just saw Tristan DeRosa, a young man, walk all the way down to Regina and have a teepee at the legislature making a point about this. I went and I saw him a number of times, not as a politician, but as someone whose life has been affected by suicide. And I can tell you that for myself and those in my life who've been affected by suicide, the proper supports were not available. I personally can tell you that I saw young men in my life. A friend of my brother's who was a missing person chose to take his own life. He was involved in searching for my little brother before my brother's body was found. And this young man was obviously struggling. I didn't see it. I regret that to this day. But I have never stopped wondering if the proper supports had been available, if there had been free, able help, someone for him to talk to, if Tom DeBetts would have still been alive today. And this vibrant, incredible, caring young man he contributed so much in his short life, but I know he had more to contribute. Mental health services should absolutely be covered underneath our universal Medicare. I want to see a situation where pharmacare is part of our Medicare plan. While this was something that the federal Greens and the NDP pushed for during the last federal election, this is something that really Saskatchewan has always been a place for firsts. It would be a natural step for universal pharmacare to start in Saskatchewan, where universal Medicare started, and we could be looking after people in a way that actually exemplifies what this province is all about. I teach seniors for a living, things like the gentle yoga program that you just saw me doing by the water here. And I see situations that would just break your heart. I work in a number of low-income facilities where seniors who are able to come for a very low drop-in fee are able to come and take my programming, and people will tell me that the doctor has prescribed 4 medications for them. They're only filling 2 or 3 of those prescriptions because they can't afford to fill all of them. Is that what we want for our parents and grandparents as they age? Not me. No, I really want to see that my Nana is looked after. So this is something that I think that all of us can relate to. We want to make sure that healthcare is a priority moving forward. We want to vote for good government, for people that are going to look after those who are most vulnerable. our seniors, those who are struggling with mental health issues, people who will not be able to get the job that would help them and their families the most because they need good dental services, and people who are benefiting from alternative health practices like reflexology, acupuncture, massage, and they can't afford to pay the rates that right now aren't subsidized by anything unless you have a group medical plan. These are things that can be improved by good legislation. Saskatchewan Green Party is prepared to look after those kind of health needs in our community. Vote Saskatchewan Green Party this October 26th, and let's make sure that the health of Saskatchewan people comes first. That is our health platform. This is Naomi Hunter, leader of the Saskatchewan Green Party, coming to you from an absolutely incredible campground out in the middle of nowhere between Green Lake and Big River, Saskatchewan. Thank you.